Hello.
Hello. How are you, Mate?
Morning.
Morning. For you,
I,
it's evening
I'm
now.
already
Almost
exhausted.
evening. Yeah. It's been a long day. Uh,
Yeah.
yeah. How have you been since we talked 24 hours ago?
I don't know. We have quite, I would say, interesting situation here. We are in the middle of a referendum campaign, and one of the topics is also cannabis legalization.
Oh, really? Oh, wow.
So I'm leading a coalition of civil society organizations against legalization.
Yeah. So you're busy. That's a big pull of your attention because we had that too. I remember when it was up for debate here in Canada, like so much of our attention is going to that because you're obviously trying to influence the policy and it's the moment. You don't want to miss it. Oh my God, you have your hands full, Mate.
So until 9th of June,
Oh, that's when it is? 5 more days.
5 more days.
Yeah. Wow. Okay. Well,
So it will be together with the EU elections.
oh, is it?
Yeah,
Same day?
that's what they wanted.
Yeah. Ah, okay.
Yeah, to
Because
attract
on,
more.
on 9th of June, the whole of Europe votes for the new parliament.
Oh, wow.
Yeah, that's what they wanted, and they picked up some topics which could attract more liberal and left-wing voters.
Oh,
Because usually at the European elections, uh, the right-wing parties are able to mobilize people a little bit better than left-wing and liberal parties.
oh,
So actually it doesn't even it's not necessary that they will go further with these policy measures, but they just wanted to attract more people, and
right.
the topic is
Election
out, and we
strategy.
we have to deal with it.
Wow. Right. So you don't even know what'll happen after if it
No,
did pass, if it would even amount to anything. So your work will continue, Mate, after potentially. The election might not be the life you continue to try and influence whatever the outcome might be. Hopefully your work is done on that day, so you don't have to keep so busy.
let's see. If they're happy with the result, they will probably stop working on these
Uh,
topics.
oh my goodness. Hi, Ganna. Hi, Sarah. I didn't say hi to you properly. How are you too?
Hi.
How's it going?
Good. I just wanted to check who will show the presentation. Sarah will show.
I think so, right,
Yes.
Sarah?
Yes, I will share. Let me try just to make sure that it
Yeah.
works.
Were you able to make a OneDrive link?
Yes, I was
Nice.
also, I saved it on one.
Nice. How did the formatting look? It didn't change, nothing wonky happened?
No,
No?
I don't think so.
Okay. It looked like when I was sending it on the last slides, it was like doing something weird with the QR code. But you know when you preview it in like your email, it's like a bit of a different dimensions or something. So I was hoping that wouldn't happen when you had it and it looked okay.
No, I think it looks okay.
Great.
I will try to share it from here or here.
Oh, the link? Oh,
I can also share the link.
Oh, whatever's easier.
Yeah, you should be able to see, right?
Yeah, we can see.
Yeah, it looks good.
Can you navigate as well?
I have a menu at the bottom. Yeah, I can.
Yeah.
Oh, is that a new
So I think
thing?
all presenters should be able to navigate.
Wow.
Wow.
That's new, I think.
Not saying next slide, please.
Yeah. Cool. That's great.
You say next slide, we say push the button.
Yeah. You have control. That's cool. That's awesome. Let me try clicking through. Oh, wow. Look at that. Oh, my goodness. So cool. Nice. And I tried to do some of the coloring and stuff. But, oh, I think you fixed some of them. You made it alternate properly, Sarah. Yeah?
Yeah.
Amazing. So good. Okay. Oh, and that one. Were you happy, Mate, with these two slides that I made that were for your Did you have a chance to look at them? It ended up being a lot of stuff. I was like, oh, we've done a lot. We have stuff coming. We had some good tips. So I ended up putting it on 2 slides. Was it all good? I don't know if you want to make any changes or anything, but.
Yeah, but regarding the chapter on the way forward, I will really focus to save some time, mostly on conclusions.
Yeah, you're just going to essentially read these 6, right?
Yeah, I
Yeah,
will discuss
I think
these
that's
6,
fine.
and then
Yeah.
I will go to the next 2 slides.
Yeah. This one and this one. Oh, see, Sarah, see this QR code? I think we should make it a little smaller. If you put the OneDrive link, I can do it. It's covering up the text for some reason. It wasn't doing that on my computer. Yeah.
I just made it smaller. I'm not sure. Maybe I probably have to stop sharing and then reshare.
Yeah. Okay, cool. That was the only thing I thought might get messed up, but.
This is the link to the.
Oh, nice.
We have someone in the lobby that says just making use of the Global Society Report on Drugs.
Who's that?
As their name?
As their name.
Okay. That's funny.
I'm really curious who is behind this.
Do you want me to admit them?
No, not yet.
Yeah.
Not yet.
I don't know why it won't let me navigate to chat while I'm in the screen share for some reason. It always gives you some problems, you know?
Okay.
Oh, there we go. Nice. Oh yeah, now I can see it. Great. I'll copy the same thing on the second slide too, Sarah. Make it a little smaller. There we go. Now they should both hopefully show normally. When we.
Yes.
Maybe we can test it again before we get started. And you both were able to see the co-chair notes that I ended up making. I realized that there was a lot of stuff, a lot of Q&As, the interventions at the end. So I thought, why not just keep us super organized? Was there anything about that you wanted to change, or did it look okay to you, Mate? I had some prompts for you too, Sarah, like to share this in the chat or to start the slides and stuff to follow that along. I can put the link in the chat too if people haven't seen it, or.
Yeah, please. I didn't look at it.
Oh, did you see, Mate? Just a Google Doc.
Yeah. Yes, I see.
Oh, great. Yeah. And Ghana, like for you, it just says like when, your slide is
and this is just for us, or
just for us. Yeah. For us. And
so
Augusto.
When you admit people in, then we have to delete it, right? Oh, you mean in the
chat? Yeah. Is everyone going to be able to see our chat?
I think everyone should be able to see the chat.
Oh, so then I can delete it right now.
But not incoming. Sorry, like once they come in, they don't. They don't see the previous message.
So they won't see these messages.
Oh, okay, then it's good.
Yeah. Only if they're part of the VNGC board and part of our team's environment.
Yeah, because it won't even let me delete it. I'm having some weird problems. Okay, cool. Oh yeah, so all 4 of us are in there now. Nice. Yeah, and Mate, I looked back at like our last webinar notes where we co-chaired. So I copied over some technical details, things about like translation, using the Q&A, that we're doing it 2 times. So I thought it might be easy for you if I just dump them all in there. So hopefully that looks good. And then, yeah. And then I tried to organize the interventions from regional and input to kind of not only intermingle with people talking like other people, but also to alternate the video and a live. So I ordered it and then I updated it, Sarah, in the other agenda document we had to be the same order, but just kind of wiggled those around a bit. But yeah, other than that, I mean, everything is, I think, what we talked about.
Yeah, I saw also you put a lot of text under some slides.
Oh yeah.
As I said yesterday, I will try to shorten as much as possible.
Oh,
just
absolutely.
To save some time, because the most important part is discussion and questions and answers.
Yeah. Yeah, a lot of those were what was there from, I didn't change stuff from the slides for the CND side event. So there were just some old notes that were in there. So I mentioned in my email, like people can look at those if they want to refer to it or pull anything, but no need to use those. I timed myself for the human rights and data and progress trends and challenges, and I definitely don't take the whole 15 minutes. I think I would think I was like 11 minutes because I spoke a little bit in detail about human rights and tried to dig into that a bit, but I don't take the full time. So hopefully that'll be okay. And I guess, do we want to have like a WhatsApp group between us if we need, or do you think we can just use, I mean, we'd be bothering the other people, but what do you think? We can just use
think we
the
can
main
just
one,
use
right?
the existing one, yeah.
Okay.
In
Okay.
case, yeah.
In case like we're like, we're having some time issues or we need to keep in touch some way as it's happening.
Yeah, but I hope other knows what is going on. Otherwise, they will be curious what's happening.
I know.
I think they know. They will know.
I think everyone should know, right? By now.
Yeah. Okay, great. And Sarah, were you able to send out an agenda to the registrants today?
Yes, you should also have received it in blind copy.
I don't think I did.
No? From the Vienna NGO committee and from the info email.
Oh, I don't see it. Having some tech problems, maybe.
Weird.
But others got it, like Mate, you got it. It's just a problem with me, right?
Mm-hmm.
Yeah, okay. Maybe it'll come late. Sometimes there's weird delays and stuff with listservs. I don't know.
Yeah, no, that's weird. Maybe it ended in your junk mail?
No, there's nothing in there. It's empty.
Okay.
Oh, okay. Okay, great. So, and you have a hyperlink to that, Sarah? Because I put in the notes, the flow, like a chance to put a link to the agenda in case people didn't see the email.
Yeah, I think I should be able to upload the PDF in the chat.
Oh, okay. Oh, like as the attachment.
Yeah.
Then a link. Okay, that works. Yeah. It was just that, and then one point I had a prompt for you to share the report in the chat too.
Okay, I can.
When Mate is talking, because I had a point from Mate to say, "Oh, we're only giving you a little taste of everything, so please read it." So like, put the link in that, draw more people if they haven't seen it.
That should be motivation for them to read, finally to read the report.
Yeah,
to read the whole thing.
They haven't. Yeah, exactly.
So it's not a reading exercise today.
We should produce an audiobook for everyone.
Yeah, of course. For lazy people.
Yeah, you can listen to it when they're driving, going on walks.
It would be just 2.5 hours, so it's just small book.
Oh yeah,
exactly.
Nothing for one day, for half a day.
Just one long walk.
When you play audio,
listening such a lot that 2.5, it's just peanuts.
When you play audio, you can put on 1.2, 1.4 speed, so it's even faster.
Yeah. Okay, great. So then, Sarah, you will rely on us to flip our own slides. We'll just use the function, and then you don't need to do it, and it keeps it easy that way.
I think I might still, I don't know, I think I'll still do it just to make sure that everyone sees the same slide.
Oh, okay. So don't press the buttons then.
No, you can press the buttons as much as you want.
Oh, you meant that you'll share screen, but we can click our own. We won't rely on you to click. Yeah, that should be okay. Because it.
No, yeah, but I'll just click through with you because I'm not sure which what the participants will see.
Oh, like if I'm clicking it myself, it maybe is just for me. You're thinking, rather
yeah,
than
exactly.
everybody?
But I can make you a participant.
Oh, I'm happy for you. Whatever's easy. Because it was a new function, I wasn't sure.
No, just to test it out quickly, just to make you a participant now. Share the screen and then you can let us know what you see.
Okay.
And I'll share my screen again. Can you, as a participant, now also see the notes?
No, I can't see the notes.
Okay.
But it looks like I can maybe press navigate forward, Sarah. Should I try it? As an attendee,
Yeah,
I shouldn't be able to do that, right?
No, you can. I think you can still see the whole. Attendees can still navigate through, but they shouldn't see the notes.
But other people shouldn't see me navigating forward as an attendee.
Exactly. Yeah.
Oh, I got you. Like, let me try it right now. I'm gonna press go to slide 2. Can you see that? No, because it gives me a message too. Live sync to presenter. So because I've gone ahead. Oh, that's interesting. So people can kind of navigate the slides as they want to. If they miss something, they can go back. That's cool.
And now I'm moving because I'm presenter.
Oh,
yeah,
but
no, I can't see that.
I can't see you moving. Did you just move
okay,
it?
so I have to move.
Yeah.
Okay.
Oh.
I put it sync to presenter.
I think
you
I
could not
cut.
see.
Nancy, sorry, I think I wanted to make you a presenter, but instead I removed you from
It's okay. Don't worry. It's okay.
Sorry.
No problem. Okay, so we won't click the buttons. We leave it with you to click the buttons. That's where we landed. Okay. So we'll say next slide to you. Okay. Cool. And did you want to check that the last ones look okay, that we move the QR?
Does it look better now?
Yeah, that one's good. And the next one is good. Yeah. They're both not covering the text anymore. There's our cute picture. Great.
And can you as presenters see the notes? Also not. Okay.
Sarah, I left and I came back. I don't know if because I was here before, I can see the links in the chat.
So we should maybe delete those, huh?
I know. I don't know. For me, for some reason, it wasn't letting me delete it.
More actions.
Yeah, when I press more actions, nothing comes out. That's where it would be, right?
Yeah, I can delete.
Can you delete it?
Well, I can delete mine.
Can you delete mine too as the organizer?
No.
Oh no. Maybe I should relaunch my Teams and try and come back. What do you think?
But I don't.
But you've deleted yours? Because I can still see yours, even though you've deleted it.
I deleted mine.
Maybe it's deleting just for you.
Me, no, it says this message has been deleted.
Like Ghana, in the chat, can you still see Sarah's message?
Yes.
Yeah, I think it just
No,
deletes.
I could not see Sarah's message. I could see only yours.
So it must be
Natalie.
something weird syncing in mine. Okay, let me leave and come back and try to delete it, yeah?
But I think others that join newly shouldn't see it.
No?
Because
you think it's just
they-
because I was here is why I can still see it, even though I left
Yeah,
and
because
came back?
they haven't joined the chat yet.
Okay. Maybe if
But
but I
don't
guess
worry, if they see it, they can help us with moderating.
the flow. I know. I could change the function so that it's not viewable. Like right now it's viewable to the public. Like if you have the link, you can view. But I could just put each of your emails in and then it's only viewable to you if we're bothered by that. You know, that's an option too. I was going to say, I saw Asia come in. And I think she dropped out again, but I wondered if she could see it, but I guess she would be able to because she's a VNGOC, so it's not a good test.
Yeah.
Yeah, so that does it. Check it for us. Why it's not letting me do it? Okay, we still have 5 minutes. Should I relaunch my Teams and try? I can go and come back, Sarah, quickly.
I don't think that's necessary.
You don't think it's necessary? You feel confident
No.
that they won't see it? Okay, I trust
I'm
you.
confident that
You're the
no
queen of
one-
Teams, so I don't know. I
that no
never
one will see
use
it.
except for our stuff. I always use Zoom, so even Zoom, I still get confused and don't understand. So okay, I won't worry about it then. Okay, great. Oh, I forgot to put Sarah start recording in the flow, but you know to do that. So you don't need that in my notes. I was just trying to think of everything, but
It's
you already
already
got it.
recorded.
You're so well organized, like
Too organized,
everything
maybe.
to be written.
It's already recorded. It was set to record automatically.
Amazing.
Otherwise, I always forget.
I know. That's why I put all these notes because I'm like, I'm going to forget something if I don't do that.
We had several meetings when we really forgotten to record, or in the middle of the meeting when I recognized that it's not recorded.
Yeah. Well, the automatic.
And then you
is the way
start
to
again, right?
Yeah.
No. It means that the note taker or somebody, usually me, need to remember what people are saying and to be attentive.
No. That's hard to remember.
Not rely
everything.
on the recording.
Yeah.
Do not to trust your memory to the Kodak. It was some advertisement, I don't know, 30 years ago. Trust your memory to Kodak. so don't trust your memory to recording.
It's a good slogan. I like that. It's funny.
Should I let in the people now?
Oh, 3
Starting?
minutes. Still 3 minutes.
Yeah. Okay. It's only 6 people in the lobby so far, so.
Oh, okay.
1 minute
so I
before.
hope a few more people will come.
Yeah. But it's good. We're recording it too, so we can always spread it around. But we do need people for our discussion, so hopefully.
I'll start admitting people so that we can start at only maybe 5 past.
Sure.
Because it will take a while.
Hello, folks. Welcome. Thanks for being here. Just admitting people. We'll get started in a few minutes. Hi, everyone. Thanks for joining. Just giving it a few minutes as people join us today. We'll get started soon.
Can I see some? Close your Bible.
Should we get started, or do you want to wait a bit?
Sure. You can get started and people can just join us as they're able to. Yeah? Great.
Yes.
Okay. Hello, everybody. Welcome. Thank you so much for being here. We're gathered today to speak about our Global Civil Society Report, which was the contribution of civil society around the world convened by the New York and Vienna NGO Committees on Drugs for the midterm review of the CND, which of course took place just a couple months ago in March, but its findings are relevant for the future as well. So we're really happy to come together with civil society today and dig a little bit deeper into our report and have an opportunity to discuss it with all of you. Really pleased to be jointly convening these webinars between our two committees, New York and Vienna, and to be co-chairing with Mate today, the chair, of course, of the Vienna NGOC. And I should say I'm Nazli Maksudi. I am the chair of the New York NGO Committee on Drugs. So happy to see many of you here today. Let me pass it over to Mate. He's going to take us through some of the technical details before we get started.
Hello, thanks Nazli for introduction and to opening the webinar. It's my pleasure as well to co-chair this webinar. We are just implementing our promise because at the CND we promised that we will organize some dissemination events like webinars to present a little bit more the global report and give people an opportunity to discuss and open questions and discuss also about the content of the report. We are now a little bit after CND. We are searching for a new momentum with this report. There are several activities in front of us, advocacy activities, dissemination activities, and this is a perfect opportunity to get this new momentum with our report. As you know, there will be a second webinar tomorrow because we want to accommodate different time zones. So those who are able to join us tomorrow, more than welcome to come tomorrow as well. And the webinar will be recorded. And please mute yourself when if you're not speaking. But when you want, as soon as you want to speak, of course you can unmute yourself and ask question or make a comment. There will be no interpretation today. It will be only in English, unfortunately. There will be also an agenda of this webinar in the chat. So you can see what we are going to talk about, the main topics. You can also use chat and Q&A. It's also available for comments and questions. You can raise hand to ask question or make a comment. So please do that. This webinar is not about the presentation itself of the global report, but about discussion about especially about the way forward, what we can do to improve the situation in the field of drugs globally. There will be also an opportunity of questions and answer and discussion after topics will end. So we will have different slots for questions and answers. So you will be able to use this tool as much as possible. Only a selection of points for each session will be presented from the report because we don't have time to go through the whole content. So those who want to know more about the report, and if you didn't do it until now, so please link to the report will also be published in the chat. So please read the whole report. It's very valuable.
Mate, we lost your audio.
Somebody muted me.
You're back.
I'm not touching my computer at all.
I got muted too. Don't worry.
Yeah. So where I stopped, what you
Just
heard?
saying you're encouraging people to read the report if they haven't already.
To read the report because it's a valuable tool for all of us, no matter from which area we come from. Everybody can find something useful for our future activities and improvements. So please read the report. And Nazli, I would like to pass back to you.
Perfect. Thank you, Mate. I think we're ready, Sarah, to get started with the slides, if we're able to screen share. And we will share, as Mate said, the agenda and the link to the report in the chat. So I'm sure Sarah will get to that shortly. So if you haven't seen those, please do check them out. I know the agenda was also emailed. Perfect. So I think everyone can see the slides now. We're going to get started. We can go to the next slide, Sarah, just to share a little bit about the methodology and the process that got us to the publication of the report. So last year, we entered a joint agreement between the Vienna and the New York NGO Committees on Drugs to work together as equal partners in order to ensure the broadest and most inclusive civil society engagement in the 2024 midterm review, building upon the success of our past collaborations like the Civil Society Task Force, which some people may remember. Now, since that announcement, we held extensive consultations to gather input from civil society on the progress and challenges in implementing international drug policy commitments. We had a global online survey that resulted in inputs from civil society around the world. And we also hosted 4 regional consultations, namely for the Africa, Asia Pacific, Europe, and Americas regions. And then we took all of these inputs, as well as the civil society statements that had been made at thematic discussions from 2019 to 2023. We brought those all together and summarized them in our Global Civil Society Report, which was published by both of our committees and was specifically submitted as a written contribution to the midterm review of the CND. We're really pleased to be presenting that today. We think it has relevance, of course, for the midterm review, which it was created for, but also long after. And we do have on our screen here a QR code to download the report if you haven't had a chance to do that yourself. But I think now I'll take it to Mate. He's going to speak a bit about our respondent characteristics and an overview of their perceived progress and work on challenges.
As most of you know, there was quite an extensive consultation process, and we got, I would say, more than 200 NGOs participated in different phases of from survey to live or online consultations, and contributed with their inputs to the global report. And especially what is important that the most respondent NGOs were relatively small NGOs with 10 or fewer employees operating at the national or local level. So we really got the inputs from the ground, from those who work with our target populations. Also, as I said, organizations, most of a majority of the respondents who contributed could be identified as directly involved in services provision to people who use drugs, people who are in recovery, and other community members, and as advocacy organizations. And the most of respondents came from field of prevention, harm reduction, and human rights focus. But nevertheless, there were several other organizations also from the field of treatment and recovery, which also contributed a lot to the global report. Yeah, and as from the report, you can also check this figure in the report. We also challenged respondents to assess the progress made or it was not made, regression also. So we opened this discussion as well to different respondents to assess this situation, and results are quite important for us because we see where we can make more improvements, because the situation regarding all challenges could be improved significantly. So we are not doing really well in this field, in field of drug policy. So there is a lot of space for improvements in the future. So that's why it's also important that we try to use this report for our advocacy, for our work, for our improvements, so we can maybe in the next 5 years we can have better results regarding implementation of different challenges. So please, Nasli. Oh, we will start as well. Sorry, I was a little bit confused. We will start to present shortly different challenges. So I will pass on to Sarah, and Sarah will cover supply-related challenges. So please, Sarah, the floor is yours.
Thank you, Mate. Thank you, Nasli, for the introduction. As you can also see from the agenda, we've grouped the challenges a bit for this webinar today. And we have one cluster of supply-related challenges, one for health-related challenges, and then we'll go on to human rights data and other challenges. And I'll start us off with the supply-related challenges, which cover challenge 1, 2, 8, 9, and 10. Challenge 1 is the expanding and diversifying range of drugs and drug markets, and was also one of the challenges that we focused on in our regional consultations, as well as the online survey. So responses gathered are from both regional consultations, the online survey, but also from the input to the thematic discussions until 2019. As you can also see on the slide, there was people saw some progress made, especially in expansion of drug checking services, expansion of early warning systems and drug monitoring services, and also an increased cohesion and alliances across regions and across organizations. But a lot of respondents also encountered challenges, not least the North American drug toxicity and overdose crisis, which has a huge impact on many lives. And especially quite a few organizations highlighted the severe impacts on indigenous populations, LGBTQA plus communities, and those facing socioeconomic inequalities. NGO responses range from all health-related interventions, covering prevention, harm reduction, treatment, recovering, counseling, outreach, and rehabilitation. Some noteworthy mentions throughout the survey and the consultations were that many respondents highlighted producing harm reduction materials for new substances and expanding the implementation of harm reduction programs. Other organizations highlighted their prevention programs, especially in schools, and evidence-based early prevention among children. Challenge 2 was also one of those challenges that we covered in the regional consultations. And progress made was, again, the increased regional cooperation, as we've already seen with Challenge 1, Some also noted that the legal regulation of cannabis cultivation could be seen as progress, though there was no consensus on this. Another progress seen was the increasing alternative development schemes that take into account the whole supply chain, such as voluntary crop substitution initiatives that ensure that there's not only crop eradication, but also facilitating access to development for marginalized communities. The challenges were again manifold, but one that came up, especially for this challenge, was funding constraints. We'll see this, I think, throughout the presentation, that this is something NGOs encounter all over the world, but especially in the global south. The public perception of stigma and discrimination encountered by people who use drugs and individuals in recovery or those with substance use disorder persist as well. And those obstruct the access to health services, including treatment and rehabilitation programs. Coordination between various stakeholders is still lacking, and sometimes the collaboration efforts with law enforcement and communities need to be stepped up. Again, NGO responses vary a lot, but NGOs did specifically mention that they work on comprehensive awareness and education campaigns. They advocate for decriminalization, responsible legal regulation, and they share knowledge between communities. I will now quickly skip through challenges 8, 9, and 10 that focus more on organized crime, corruption, and cybercrime. Corruption is something that is a challenge mentioned throughout these 3 crime challenges, and progress made is especially again on cooperation and the increased awareness among the public on these challenges and the links between drug trafficking, corruption, and other forms of organized crimes. The challenge 9 is a very technical challenge, and not a lot of NGOs work specifically on tackling this challenge. And challenge 10, the cybercrime challenge. Again, not a lot of the drug-related NGOs work on this specifically, but a lot of NGOs mentioned that they do use ICT for evidence-based drug prevention and harm reduction campaigns. And with that, I give over to Nesli to the next challenge.
Thanks so much, Sarah. That's great. We're now going to move into the health-related challenges, and it's my pleasure to introduce Ghana, who is unfortunately a former member of the VNGOC. We miss her very much already, but she was instrumental throughout the process towards the midterm review and drafting this report. So very happy that you're still with us today to present this. Over to you, Ghana. Thank you.
Thank you, Nesli. I'm still with Vienna NGOC, but not with the board. So all members of Vienna NGOC could be instrumental to the work of this committee and to our joint advocacy. So I'm happy to present the challenges where majority of more than half community and civil society organizations are working, and that's about health. And challenge 3, it's about health and regulatory changes posed by synthetic opioids and non-medical use of prescription drugs. And we have some progress in here, specifically in increased access to overdose prevention measures and improved knowledge of medical assisted treatment and experimentation for better practices during the COVID pandemic. And a lot of organizations in the survey and in the reports to the CND Intersessional reported on this. But we still have challenges connected with the mental and social risk factors, with the supply side challenges, with the transition of to synthetic drug introduced new challenges to harm reduction, and harm reduction not always prepared to the new drugs. and not all health services are prepared and have enough access to contribute to overdose prevention and actually to prevent the death. And a North American opioid crisis and impacts on tramadol in Africa, stating the importance that international control on tramadol do not jeopardize access to pain treatment. So we have challenges, but in the same time, we need to say that in the from NGO side, we are coordinated. We have plenty of educational activities, and we are implementing harm reduction programs all over the globe with the community distributed naloxone, with supervised consumption services, with drug checking, with safer supply initiatives, and with advocacy for decriminalization. That's actually what we are doing all together from different angles, and that's important response to the challenges. Next slide will show us the challenge 4, which is also connected with overdose, and I will not repeat what we really succeeded due to very bad situation with the overdose crisis. It caused some political decisions and a little bit more access to the overdose prevention and to the preventing the death, the drug-related death. But in the same time, we have some progress in expansion of drug checking services. We have some good progress in take-home methadone and gender-sensitive health services. We also already introducing Good Samaritan law, which is maybe if you don't know, it's important approach for the health and social services and police who are coming in the moment of overdose to respond in a way, in a healthy manner, in a manner of saving lives and not prosecuting for the drug use or possession. Not everywhere. From Eastern Europe and Central Asia part, I need to say that we are not in the bright side of this globe, but truly moving there. So with challenges, it's about the funding and sustainable funding for health and treatment services. Human rights abuses are still there, and unfortunately, a lot of countries disproportionately focus on law enforcement measures instead of health responses. And we do have neglecting of evidence-based prevention, especially for children and young people among a lot of countries. And limited access to life-saving medication. So what we are doing as NGOs, and there were plenty of evidence, honestly, it was hours and hours reading your responses and your marvelous experience of providing prevention, harm reduction, treatment, and recovery services and doing advocacy to prevent drug-related death. Next challenge, which is 5th, it's about the other Sarah, that the 5th challenge is about other risks connected with the mostly injecting drug use, but not that's about the high transmission of HIV, HCV, and other bloodborne diseases. And honestly, in this challenge, we see a lot of progress, which is done mainly by NGOs, because more than half and more than 66% of NGOs responded to the survey, said that they are involved in this work. And there is really accessible and affordable prevention, harm reduction, testing. They're making diagnosis, treatment, and recovery service. We really, during this assessed years, developed the HCV and HIV treatment and successful pre-exposure prophylaxis for HIV already available for men having sex with men and people who use drugs in some countries. But unfortunately, we see lack of funding for community-led initiatives and harm reduction programs, absence of comprehensive prevention and harm reduction, limited access to controlled medicine for pain relief, limited HIV and HCV testing for people who use drugs, and HIV prevention for chemsex users. And of course, criminalization, racism, and discrimination against indigenous, Black, and brown people. That's the key challenge, which result in people from these communities they really avoiding health services and not getting the services connected with blood-borne diseases. So we as NGOs could be proud of plenty of best practices, good practices of education, prevention, harm reduction initiatives, and advocacy for better access to the services. And the next challenge is the sixth challenge, is about the new psychoactive substances. And here we have less developed programs. Next slide. The less developed programs for addressing, but what we do have in the progress part, it's the early warning systems. They are developed in Europe, and that's something which civil society said that we need more and more this understanding what is on the market with the new psychoactive substances and what health consequences we have associated with this. Also, there are civil society websites and tools which facilitate better information sharing, and actually what we have, it's already increased by still insufficient number of civil society-led drug checking services, which enhance poison and toxicity information and improve cooperation between authority and national, international, and civil society who provide information. What we see as a challenges in here, it's training needed to address health risks and overdose caused by NPS use. We need we have challenges with reaching harder to reach people who use NPS. It could be youth as well, and specifically lack of specialized prevention, harm reduction, treatment, recovery, and counseling services. And we have plenty of prohibitions and enforcement crackdowns, and that's actually not helping with demand reduction, but leading to market mutation and increased harm to the people's lives and health. And what we think that could be, what we already do as NGO and what should be explored more, it's capacity building and training for health providers and psychologists, increase evidence-based prevention curricula and training programs for communities and schools, and harm reduction services, including drug checking. So that's actually leading us to the challenge 7. Next slide. They are all interconnected, but with the different angle. And the 7, it's about low availability of internationally controlled substances for medical and scientific purposes. And what we see, it's really good progress in adopting of laws and policies which facilitate access to cannabis-based medicine in at least 18 countries. And we do have more than 450 clinical trials worldwide on the use of psychedelic substances for various illnesses. So we hope to have some evidence to use it worldwide as for medical and scientific purposes. But in the same time, saying about morphine-based medicine, we have we have very, very big inequality in access to the morphine-based medicine and opioid for pain management and palliative care. The difference is very huge between high income and low and middle income countries. And in low and middle income countries, we see much stricter control and much bigger opioid phobia, let's say, the cultural bias connected with the opioid, which limit access of people to the pain management and to sharing the community knowledge and to fund the awareness raising, advocacy, and to fund the programs itself. So civil society participated in research, emphasized the need for proper research, data collection, analysis, and documenting treatment effectiveness. We need to have the proof. And among those who responded, we see that NGOs advocating for availability of prescription pain medication for patients who need them, including through the provision of safer supply programs. And when facing humanitarian crisis, violence, repression, hostility, and war, it's often NGOs come to the solution to continue delivering opioid agonist treatment, pain management, medication, and other vital drug services. And in report, you will find the Ukrainian example as well as examples from other humanitarian crisis settings over the globe. And the last health challenge. Good. So I'm passing back to Nazli to facilitate question and answers.
It's actually me. I'm the next. Yeah, thank you, Gana, for a very extensive presentation. So if I can say that you actually discouraged people to read the report. So because your presentation was so good and explaining almost everything what is written, summarizing everything what is written in those chapters on those challenges. So yeah. We have some time. First slot on supply and health-related challenges is finished, so we have some time for discussion. So there's no questions in the chat yet. So if you want to comment or make a yes, Catherine, please just unmute yourself and. Catherine, are you with us?
Okay, got it. I'm unmuted now.
Good. Yeah.
Yeah, super. Yeah, thanks. Hi, everybody. Nice to see everyone, and great report. In challenge 3, one response to Gana's discussion just now, one of the things that I may not have put in my response to the survey, so I'm sorry about that, but one of the problems in challenge 3 of the overdose crisis, as it's called popularly here, I happen to be in the States at the moment, is that in terms of challenge 7, which she just covered, the availability of opioid drugs, medicines for palliative care, surgery, harm reduction, treatment, all those things, has been seriously challenged by the opioid crisis because policymakers and regulators are unwilling to improve availability because they're afraid of a similar kind of crisis in their own country because, and this goes back to the reasons in Challenge 7, because they don't understand the need for better training of the health workforce, better training of the regulatory agencies, safer supply chains, and most of all, and this is another thing I didn't put in response to the survey, so my bad, but I'm raising it today, is in terms of the corruption challenge, which we've certainly seen in the United States, which is the iron triangle between government regulators and industry and the revolving door between lobbyists, because they're allowed here in the US for the pharmaceutical industry, and the regulators. So one of the ways to improve availability is to have better regulations and policies to prevent that kind of influence at the highest levels by the pharmaceutical industry, because there's a lot of corruption there. And that's something which civil society could certainly work on. We're not at the table enough with the drug regulators. INCB has this program called the Learning Program, which now has no funding to train the drug regulators and civil society, even though there's requests from countries and from the regional groups for the learning program. So civil society, as usual, is going to have to step into the breach and do the kind of key informant work that we need to do to improve availability. So the other thing that I can help do through my organization, which is a global organization, is to have more organizations from palliative care join VNGOC, because as you said in the presentation in the beginning, Sarah, there weren't many contributors for that particular challenge, and certainly not from lower and middle income countries. There were a lot from Europe and from high income countries. So but there's still a lot of work to do on many of these challenges, but this is a great start. So thank you.
Thank you, Catherine, very much. There is another participant who want to talk. Colin Johnson, please unmute yourself.
Hello,
yeah.
Can you hear me?
Yeah,
we
hear you.
Oh, perfect. Hi, everybody. I'm from Toronto, Stra. Hey, Nasli, good to see you again. I just want to give an update on some issues that have been happening in Canada. And I think it's really important that we understand what's been going on here. I'm sure some of you have heard, but because of, for lack of a better word, political expediency, we're now seeing where the political parties are really becoming anti-harm reduction, anti-safe supply, anti-everything. A lot of this, I think, is fueled by a very active conservative right-wing political concepts, where they just don't agree with anything that can save lives, period, anything that has to do with the poor, anything that has to do with anybody who's marginalized. But the sad part of it is they're now getting a lot of traction. In Ontario, for example, there has been a lack of funding for our safer supply, as well as our safe consumption sites. We've actually had a number of them close over the last, I'd have to say, 6 months. We are seeing a change in what was going to be a positive move towards decriminalization has just been revoked. Sadly, one in Vancouver, where the police are now back to being able to arrest people for personal consumption, and the city of Toronto, where our proposal was not accepted. It wasn't even looked at, as far as I'm concerned. So I just want to point out to you that this is really happening, and it's I mean, I don't know what we can do, because as I say, we really did, when we made our proposals to Health Canada, I thought they were solid. We answered all of their questions. The bottom line, they came back, and I think it's all about political expediency, which to me is blasted ridiculous, because now the Liberal Party of Canada is really not much different from the Conservative Party of Canada, because they both are anti-drugs. So I just want to put that out, and I suspect a lot of similar things are happening in the United States, but I just wanted to make everybody understand that. Thank you so much for giving me the time.
Thank you, Colin, for your comment. We have Pastor Ade Bodunde. Yeah. Unmute yourself and please. We don't hear you.
Okay.
Yeah, we hear you. Yeah, we don't hear you, so we will move to another one. There was one question in the chat which came in between people waiting for to speak. So from I think it's from Mart for Ghana. So Ghana, please, can you elaborate on what forms of safer supply, free paid, various non-medical prescription models, compassion clubs, etc., are being provided or discussed in different regions?
I need to say that in European, we had European consultation in 4 parts, and it was not such deeply discussed because we are mostly harm reduction. But in Americas, as I know from reading the report, it was more discussed. So I would even better pass the response to Nazli or to somebody who've been during the Americas discussion, because that's coming from their part of the reporting.
Yeah, absolutely. Thanks, Ghana, and thanks for the question. As someone in Canada where Safer Supply, safe or safer, they're called different things sometimes, but those types of initiatives have been adopted in select settings and in pilot type formats. I'm happy to just say a little bit about that because I know that it's not a term that's necessarily used in all settings, and people might not know exactly what we mean when we say Safer Supply initiatives. So these types of initiatives, they have really been a response to the overdose and drug toxicity crisis in the context of that being largely driven by a contaminated drug supply. So both in Canada and the United States, not that they have Safer Supply in the United States, but really in both of our regions, what we've seen is this proliferation of particularly opioids that are very high potency, fentanyl being one very well-known example, but many others, nitazene opioids, carfentanil, different analogs, that are being consumed unknowingly by people who use drugs, people who use opioids, and causing them to overdose at just unprecedented rates and causing a devastating loss of lives. So as a response to that in Canada, there was the adoption in select settings, permission from the government and funding to adopt what was called safe or safer supply initiatives. And this is really lower barrier provision of regulated drugs to reduce fatalities that are associated with the contaminated and unregulated drug supply. So for example, some might be familiar. I think in the European setting, the most comparable would be like heroin-assisted treatment. So the provision of these substances that are typically not available to individuals, but heroin-assisted treatment tends to have a very high barrier for access. So this is lower barrier accessibility. And there's a number of different kind of formats. We have even some creative formats like vending machines, knowing that different times of day that people can come and get their medications, making that more accessible to them. So that's a kind of one of the examples of how Safer Supply has worked. And I hope that gives a little bit more understanding of the concept. Thank you.
Okay, we will take another question, Peter Nilong, and then we will proceed because we have to we still have some other content to cover. So Peter, please.
Okay, thank you. I am Peter Nilong from Cameroon, Central African Republic, Central Africa. I want to talk about challenge number 10, which I run a rehabilitation center. And when I talk with most of the inmates who are there, challenge number 10. Yeah, he talks about social media rolling transaction and providing convenience, misuse of communication technology. Now, most of the high artists, musicians we see on internet, they smoke, they take drugs or whatsoever. And what is the policy that if somebody is doing that kind of thing on the social media platform, can he or can the state where that person is not be arrested? Because here back in Cameroon, those inmates that I have, once they see these artists, these people who are high placed, they have money, they are taking these drugs openly on social media, they too are inspired to take it because they say, if this person is doing this and is rich and nobody can touch him, is untouchable, then I too can do it. And when they take it, it leads them to another platform. So what is the state or the United Nations doing on holding people responsible on social media who are into transaction or in taking drugs?
Thank you very much. We have to move on because we still have some content to cover. So Nazli, I would like to pass on you and to cover the last set of challenges. Thank you.
Thanks so much, Mate. So we're going to move now into the human rights and conventions related challenges, as well as then the data related challenge, before a little bit about progress, challenges, and emerging trends that came up more generally from our respondents. So moving to the next slide, challenge 11. This is, of course, about the non-compliance of responses with international drug control conventions and human rights obligations. Now, you'll see from our little graph on the left-hand side that the predominant position, most common position among respondents to the survey was that there had been neither progress or regression. That was followed by some who thought there was progress, and then lastly, those who thought there had been regression. But when we took a little bit of a closer look at the regions, what we saw is that those from Africa and Asia Pacific were more likely to indicate that they observed at least some progress, but those from Europe, North America, Latin America, and the Caribbean, and those working globally were most likely to indicate that they'd seen regression in regards to this challenge. Now, this challenge has kind of two perhaps distinct prongs, this idea of non-compliance with the conventions and non-compliance with human rights. But it was interesting at the European Regional Consultation, there was really this discussion that non-compliance with the drug control conventions is often linked to non-respect of human rights. So really a connection between these two, sometimes answered jointly, sometimes answered separately in our responses, but there is certainly overlap between these elements of this challenge. And something that was identified there as well was that the absence of a systematic mechanism for addressing noncompliance when countries do not adhere to the conventions, including noncompliance with respect for human rights, that is a key challenge that was identified. Now, I'll speak first about noncompliance of drug policies with human rights obligations. So we saw a discussion of human rights violations related to the right to health, the right to life, right to be free from torture and other cruel, inhumane, or degrading treatment or punishment, right to be free from arbitrary arrest and detention, right to a fair trial, as well as the right to equality and freedom from discrimination, among other human rights as well. Now, the human rights concerns included a variety of different aspects, but some of those were the criminalization of people who use drugs, as well as those at the lowest level of drug trafficking, the use of capital punishment, as well as extrajudicial, summary, or arbitrary executions for drug offenses, the use of compulsory treatment for drug dependence, insufficient access to health services, and that includes evidence-based prevention, harm reduction, treatment, and recovery services, and insufficient access to controlled medicines, as we've talked about a little bit today as well. And stigmatization and discrimination against people who use drugs, including those in prisons and other places of detention or closed settings, and their further marginalization on the basis of race, gender, class, and age. Some other human rights that came up, for example, from respondents in Latin America, was the ensuring of a safe, clean, and healthy and sustainable environment in order to respect and protect and fulfill human rights. That was seen as a key challenge, and drug control measures were seen as posing a challenge to the climate crisis. Another human right element that was raised was with respect to the shrinking civic space, which creates barriers and challenges for civil society and undermines the right to freedom of opinion and expression, the rights to freedom of association and peaceful assembly, and in some cases has even led to the closure of life-saving harm reduction services, which of course undermines the right to health and the right to life, among others. Now, many expressed support for proportionate sentencing, decriminalizing drug use and possession, ensuring that law enforcement efforts are fully consistent with human rights as well. There were concerns raised about racial profiling and targeting by police of marginalized populations, and that included migrants, undocumented migrants, refugees, racial minorities, people of African descent, Roma people, Indigenous people, and youth. And some also brought up the importance of rights in the UN Declaration on the Rights of Indigenous People, as well as the Convention on the Rights of a Child. In addition, some were welcoming the growing body of commitments, findings, and recommendations from across the UN system on human rights. So an example of those was within the international guidelines on human rights and drug policy, the UN system common position, as well as resolutions from the Human Rights Council and a recent report from the Office of the High Commissioner for Human Rights about human rights challenges and addressing and countering all aspects of the world drug problem. So lastly on this, there was a call for further collaboration across UN bodies that was called for in order to enhance coherence between drug control and human rights and the Sustainable Development Agenda. Some thought that the CND and UNODC could potentially consistently incorporate human rights into their work by establishing a standing agenda item at the CND to address human rights and including a specific chapter on human rights in the UNODC's World Drug Report, which would be informed by other relevant UN agencies and bodies. So now I'll speak about the other element of this challenge, which is the non-compliance of drug policies with international drug control conventions, where some people were sharing their perspectives on the legalization and regulation of cannabis for non-medical and non-scientific purposes. Some thought that these approaches were in conformity with the conventions by upholding their overarching purpose of ensuring the health and welfare of humankind, but others thought that these approaches went beyond the flexibility that's offered by the conventions. But across both of these perspectives, there were really concerns related to the challenge of commercialization of cannabis and corporate capture. And although there was no consensus, given the reality of changing cannabis policies, some thought that there should be more open discussions at the international level about how the regime should be reviewed and modernized to accommodate this reality and make sure that legal regulation is actually aligned with the UN pillars of human rights, development, and peace and security. Concerned that the regime will grow obsolete increasingly if it fails to acknowledge these shifting national approaches. And related to all of this, some respondents also welcomed the World Health Organization's critical review processes for cannabis, as well as the coca leaf, which is of course ongoing and forthcoming. Now, lastly on this, about 39% of the respondents to the survey indicated that they work on this challenge. There was a lot of different activities, and those included conducting research and advocacy, producing publications and other resources, raising awareness, engaging with government officials, strengthening partnerships, documenting human rights violations, delivering frontline services, and providing legal support to affected populations. So that's all I'll say about Challenge 11. We'll move into Challenge 12 now. This was really the topic of geographical coverage and availability of reliable data on different elements of the world drug problem. It was not selected by the CND for the thematic discussions, even though it was highlighted, of course, in the 2019 ministerial declaration. So we did not specifically include this in our online survey. That's why you don't see that little bar graph that all the other challenges have. We didn't ask folks to assess progress or regression, but survey respondents and in the consultations, of course, this did come up. So it was important for us to raise today. Now, those who talked about this, they discussed that UN agencies should provide more reliable, comparable, detailed, and verifiable data that demonstrates the magnitude of current and future drug-related problems and trends, especially among vulnerable populations. Some also identified challenges in their work, like the lack of detailed and comparable information in official international or national drug reports, lack of data on evidence-based prevention programs, flawed implementation of international prevention standards, and inadequate coverage of and access to treatment, harm reduction, and recovery, especially among girls and women. And some global initiatives have been launched by civil society and the academic community regarding proposals for additional indicators, such as on human rights and the harms and consequences of drug use. And one example of that is the Global Drug Policy Index, or the GDPI. Now, moving on to some more general kind of reflections on progress, challenges, and trends. With respect to progress, there was a recognition of improved or increased civil society involvement and collaboration, particularly people who use drugs, people in recovery, other affected populations like farmers, youth, and indigenous peoples. And at the UN level, there was a recognition that the broadcasting and archiving of CND proceedings on UN Web TV had helped to improve civil society participation, and that some member states had begun including civil society on their delegations to the CND, which was an improvement as well. With respect to progress, there was standards in the field of prevention, treatment, and recovery that some saw as being progress, but there was a recognition that the lack of a corresponding challenge for the area of prevention and recovery was a shortcoming of the way the international dialogues have been structured. Now, many noted expanding harm reduction approaches as a positive development, mentioning different diverse service models and interventions, so supervised consumption, drug checking services, this idea of the global public health crisis, including the overdose crisis and drug toxicity crisis in North America, was raised. There was a need to include harm reduction explicitly in language adopted by the CND, which of course did happen for the first time in the most recent session. So glad to see some of the calls in the report being reflected in international policy, and just the need for more innovative approaches. And one example of that was safer supply programs, which I've already discussed, so I won't explain again here. Now, some also saw progress in the legal regulation of drugs. They thought that this was opening the debate and that the initial results from these frameworks were positive, and that this was really a tool to break the link between drug markets and organized crime. And some also were pointing to the report of the Office of the High Commissioner for Human Rights, which I had mentioned, which actually called for the consideration of legal regulation of drugs as a recommendation from their office. But contrastingly, some NGOs were also pointing to legal regulation as a setback, so certainly not something that there was consensus on. Now, moving into challenges, several respondents really observed that while there's been a shift in the discussions of drug-related issues, this has not materialized into policy changes at national and international levels consistently. There's a lack of political will to reform legislative frameworks, even though there's a need with changing issues and realities and alternatives. Now, in the fields of prevention, harm reduction, treatment, and recovery, some highlighted the need for more indicators to measure progress, and highlighted the possibility of introducing respect for human rights as an indicator for the evaluation of drug policy. Now, multiple NGOs who participated in our consultations were directly affected by war and armed conflict, but they continued providing services and life-saving assistance to people who use drugs in these challenging circumstances. Despite civil society involvement in some contexts, several NGOs highlighted that poor cooperation with the government and a lack of safe space for civil society due to threats from officials and criminal groups involved in drug trafficking was a major problem. And a last challenge that I'll flag here is a major overarching issue, of course, is that lack of sustainable funding. I think we can all resonate with that, as well as some actually pointing to the misallocation of resources, with health budgets being diverted to other sectors like the military. Now, finally, on trends, there was increased engagement of UN human rights bodies, including to address the 2030 Agenda for Sustainable Development. Some saw a growing need for UN guidance and recommendations on legal regulation that would be in line with health, human rights, and development. There were growing calls to put racial justice, equality, and non-discrimination at the center. Criminalization of women and youth under the pretext of the violence associated with the drug trade and law enforcement was seen as a challenge, pressing trend. And another pressing concern was the need to decolonize the drug control regime. So recognizing the tensions between the conventions and the rights of Indigenous people and the systematic kind of threats and violence that Indigenous leaders face who are protecting their communities and their habitats, and the environmental harms, which I had raised as well. And lastly, some NGOs underscored the critical importance of tackling root causes of drug-related challenges, and those include poverty, inequality, and limited access to education and healthcare. So thank you so much for your attention. I'll pass it back to Mate.
Thank you very much. There is already some discussion in the chat with questions and answers and comments, so it's it's intensive there as well. So we'll keep it like that. So I would like to just ask my colleagues who are not so much involved in moderating, in facilitating this webinar, to check the chat as well, and try to comment and give some relevant answers, so we can save some time during our session. So I think we don't have a lot of time because there is still a lot of things to cover today, and we have about half an hour still on the agenda. But I promise, if there is time left at the end of the webinar, we will definitely come back and open another slot for questions and answers and discussion. Let's proceed with Okay, so I cannot change slide, so please, Sarah, next slide. Yeah, you can also find in the report quite extensive chapter on the way forward. We try to summarize also a lot of discussions and also results from the survey about opinion and also about the plans of civil society organizations, how to move forward from this situation. And we got a lot of really quality relevant answers and comments. So the whole chapter on the way forward is quite important for us, which gives us a lot of directions for the future activities, for the future advocacy activities. And I would, to save some time, I would like to summarize the six key conclusions from the report. And those are especially includes especially capacity building and comprehensive public health training is needed, not just in the civil society organizations, but also in other sectors, in public sector as well. There is also one of very important conclusion is that we have to invest more in evidence-based prevention interventions, because we know from our practice, from our daily work, that there is still a lot of ineffective or also harmful practices around, and we have to switch those practices to more evidence-based, and we have international standards on that. So we have a lot of good tools which we can use to improve our prevention interventions. There is also a need to improve access to harm reduction treatment and recovery services. So this is as well work not done well yet. So there are a lot of regions, a lot of countries, local communities which lack this access to evidence-based harm reduction treatment and recovery services. Another very important conclusion is that we have to also highlight a little bit more and address a little bit more root causes of drug-related issues. Sometimes we think that we are too much focused on drugs themselves and the problems directly connected to drugs, but there are a lot of root causes of this situation, such as poverty, structural violence, racism, inequality, lack of access to education and healthcare. All those issues are very strongly related to the situation in the field of drugs. So we have to address a little bit more those issues in the future. There also should be a shift towards health-focused policies rather than punitive measures. And the last one, and not least important, is that we have to enhance collaboration across UN bodies to enhance coherence between the international drug control regime and international human rights obligations. And also several other UN agencies are involved more or less in the drug field. So we have to enhance and improve the collaboration between those UN bodies and agencies. And placing equality and non-discrimination at the center of drug policy making, and not just drug policy making, also policy making in other fields which were mentioned, like in the field of poverty, violence, racism, and so on. So this is just a short summary, but those who want to read a little bit, know a little bit more about the conclusions and the recommendations from the report, there is the whole chapter in the report about this topic, the way forward, and including the conclusions. So you're more than welcome to take the report in your hands and read the whole report, especially this section on the way forward. So yes, that's and as well we have to mention that in the meantime, when the report was published, actually a lot of activities were already implemented. So a lot of work has been done already between in February when the report was published and today's webinar. As most of you know, the report was published as a stakeholder contribution to the midterm review and also as an NGO paper to the 67th session of the CND. It was presented during the general debate of the high-level segment at 4 high-level side events, several CND side events, including one focused exclusively on the report organized by Vienna and New York NGO Committee and our partners in this process. There is a link. You can also watch a video recording of this event online if you missed it. We also targeted outreach. We targeted. We specifically advocated and presented this report to several member states, including to influence their pledges as part of the Pledge for Action initiative. And we know from this initiative that a lot of pledges actually included also meaningful civil society engagement and a lot of our recommendations and conclusions in their own pledges. So it was quite well disseminated and successfully disseminated among member states as well. We tried to reach to make a broader outreach to civil society, including to influence their pledges as well. So we also asked the civil society organizations were informed about the report before they were asked also to submit pledges. So in many of them, the influence of this report is obvious. Is there in their own pledges. And we also hosted interactive webinars like this one, and it will be another one tomorrow. We established also an impact coalition on the future of drug policy for the preparation and engagement on the Summit of the Future during the Civil Society Conference in Nairobi. And this impact coalition will definitely take some messages from this report as well to plan some future activities and advocacy actions, not just during the Summit of the Future, but also beyond the Summit of the Future in the next 5 years before the next political declaration will be hopefully adopted at the UN level. So next slide. I will try to be as short as possible. What is coming next? I mentioned already there are several plans already with the Impact Coalition. We will try to attract as many partners as possible, including member states and UN agencies, not just civil society organizations, to do some work together, to plan and implement activities together with other stakeholders. This will be quite an intensive period before September and Summit of the Future to prepare a kind of action plan to bring together different stakeholders to plan activities and actions together. Most of the focus in the next couple of weeks and months will be we will put in this. And also we will definitely disseminate some of the information from our report during the launch of 2024 World Drug Report, which will be in June 26th. Definitely one of the, in our statement, this report will be mentioned related to the topic of the main topic of the report, the main topic of the World Drug Day, and so on. So we will definitely use the report to spread this information in this event as well. We will continue to select speakers for the next CND thematic discussions in the period of 2024-2028. So there is a guarantee for meaningful civil society involvement. So we will definitely continue to bring civil society representatives to thematic discussions. And maybe as a recommendation to other NGOs, to other stakeholders, what we can actually do to further implement or to improve situation in the field of drug policy, we can, of course, share and use the report as a basis to meet with policymakers member states, but not just policymakers, also with other civil society organizations. Whenever we have an opportunity to speak to UN agencies, we can also use report as a reference. In our education and training opportunities, we can include this report as an important source of information and also resource when convening civil society and engaging in collaborative partnership with other stakeholders. We can use it to submit abstracts and present at the different events, at conferences and meetings. We can participate in the work of the Impact Coalition. We can suggest and plan also different actions which will be part of action plan of Impact Coalition, and continue to follow and engage in activities held by Vienna and also New York committees on drugs. Very shortly, you see a lot of work has already been done, and it is continuing momentum. After a report was published and presented at the first place, so we will keep you updated and informed about all future activities, and more than welcome to join us in most of them. Thank you.
Thanks so much, Mate. That's great. So that brings us to the end of our slideshow element of the evening or the morning, wherever you are in the world. We'll now open up the floor for some questions. We do have some interventions from folks from our regional groups and from the International Network of People Who Use Drugs. So perhaps I should go to the first couple of those, and then we can open the floor and then go to the last couple of those, if that makes sense for folks. So in which case, I'd love to introduce the first intervention, which is from Aditya of the International Network for People Who Use Drugs. I believe you're with us today, so please do feel free to unmute yourself and share some reflections from your network about the report and the process and anything you'd like to share. Thank you so much.
Thanks, Leslie. Hi, everybody. First of all, I just like to congratulate everyone, the team, in putting together this amazing report. Well done. Thank you so much. Sorry, it's a bit dark because it's late. I'm based in Indonesia. My name is Aditya. I'm the advocacy officer of Input, International Network of People Who Use Drugs. We are the big global member-based organization of drug-using community. And I would like to highlight several issues from the perspective of our community and networks. Too often, drug policies are crafted without the direct involvement of people with lived and living experience of drug use. And this happens because of stigma and discrimination against people who use drugs, where often we're deemed as unfit and irrational actors. And we can't continue to accept this as the status quo. It's not possible to understand the full range of impacts of current or proposed policies without meaningfully consulting with people who use drugs. For instance, our community-led research on drug policy found that purportedly well-regarded decriminalization models did not go far enough, as the threshold amount was too low and it did not prevent exposure to violence. Similarly, use of fines in decriminalization models are counterproductive as they only serve to punish the poor. Additionally, you also need people with living experience to understand what is a volatile drug market where patterns of drug use and consumption are changing all the time. And equally, there's also no movement that doesn't have people most directly impacted at the forefront. And my wish is to get to a point where it is seen as equally unacceptable to have non-drug using peers representing people who use drugs, as it is to have only cisgender men making decisions on women's bodies, or for white people speaking on behalf of Black, Indigenous, and people of color. Representation should also not be tokenistic and also cherry picking. Network representative needs to be the first port of call, and there is an existing drug user right movement, and we are here and growing. And there's been a lot of discussion about the global health and pandemic preparedness. And to be honest with you, we are hanging by a thread. Our health and well-being have always been politicized. We hardly see any human rights language in any global or high-level documents being passed without any pushback. And unsurprisingly, many of these documents also fail to explicitly mention and name marginalized and criminalized populations such as people who use drugs, including also any recognition on community-led and community-based service providers as partners, as well as within governance and decision-making. And as your report also mentioned, we have witnessed the critical role of communities during the COVID-19 pandemic on reaching those who are most vulnerable with the life-saving services they need. And these are crucial elements of effective and sustainable global health and pandemic preparedness. However, it will not be realized without repealing all the laws and policies that criminalize people who use drugs and the drugs they use. And that we need to ensure adequate sustained financing for drug user-led services to support the scale-up of effective peer-led service delivery models and innovations, and also to include sustaining the provision of an equitable access to quality health services, including access to essential medicines and controlled substances. And let me close by quoting with a quote that we got from a member of our network. Prohibition is the reason we have all these harms. We are overdosing and getting harmed and dying because of the war on drug users. When we finally acknowledge and confront the cause of almost all the harms, which is drug prohibition, we will be much closer to finally putting an end to them. Until such time, harm reduction saves lives. Thank you.
Thank you very much for this contribution. We have a video intervention from Carolina Humada from American Coalition on Drug Policies. So please, Sarah, play the video.
Yes, 1 second. I'm just sharing the video.
I want to thank the Vienna NGOC and the New York NGOC for trusting Intercambios to help organize this consultation, and to all the NGOs which participated in the middle of the summer holidays for some of us back there. I will address specifically progress achieved, the challenges encountered, and the strategies for advancing a more just and equitable approach to drug policy making in the Americas. First of all, the findings from the online survey and regional consultations addressed the topics of non-compliance of drug policies with international drug control conventions and non-compliance of drug policies with human rights obligations, either jointly or separately. This reveals a mixed landscape. While some respondents, particularly from Africa and Asia-Pacific region, were more optimistic, others, including Europe and the Americas, expressed concern about regression. One of the primary challenges highlighted by NGOs in the Americas is the persistent non-compliance of drug policies with international conventions and human rights standards. Participants emphasized the need for a human rights focused approach to drug policies, advocating for community-based action and a shift away from punitive measures. However, the absence of a systematic mechanism for addressing non-compliance poses a significant hurdle, particularly concerning the rights of people who use drugs and access to harm reduction services. Discussions surrounding the legalization and regulation of cannabis underscores the complexity of aligning drug policies with international obligations. While some argue that such approaches uphold public health and welfare, others question their compatibility with existing conventions. Some respondents welcome the World Health Organization's critical review processes for cannabis as well for the coca leaf. Particularly among some respondents from Latin America, ensuring a safe, clean, healthy, and sustainable environment to respond and fulfill human rights was identified as a key challenge. Human rights violations related to drug policies are widespread, ranging from criminalization and stigmatization to inadequate access to healthcare, disproportionate targeting of marginalized populations, and negative impacts of drug policies on indigenous peoples, as well as on Black and Brown people. While there was no consensus in the consultation, people called for member states to review and reform the international drug control conventions and system to align with human rights objectives. NGOs played a vital role in documenting this violation, raising awareness and advocating for rights compliance policies. Initiatives such as the Drug Policy Index and the American Drug Policy Coalition exemplify the power of collaboration in driving positive change. Participants also welcomed the resolutions from the Human Rights Council and the recent report of the Office of the High Commissioner for Human Rights. For conclusion, as we look to the future, it is imperative to strengthen collaboration across UN bodies, civil society, and governments to promote human rights-centered drug policies in the Americas. We reaffirm our commitment to placing equality and non-discrimination at the center of drug policy making. By acknowledging their progress made, addressing the challenges ahead, and charting a direction for the future, we can build a more just and equitable society in which the rights of all people, including people and young people who use drugs, are defended and respected. Sorry, thank you very much. Esteemed panelists and audience.
Great. Thanks, Sarah. And we're grateful to Carolina for providing her video intervention. We have just a couple other regional interventions that we'll go to, and then we'll open the floor in the last few minutes for some additional comments and reflections, I think, for sake of time. So allow me to please go to George. Oh, thank you. To George from the African Civil Society Forum on Drugs. I believe you're live here with us today, George, so please feel free to unmute yourself and share some reflections from your participation in this process and your regional partner group. Thanks for all the work you've done.
Thank you very much, Nazli, for this opportunity, and even the VNGOC for the good work that they've done. I have a few areas of intervention that I would really want to put across and see how we can move forward. One is that we truly appreciate the good work that the two bodies have done to come up with a report. And as a regional body, we are looking forward to see how we are going to ensure that we work with this report together with member states to implement it fully. Further to that, we are also looking forward to domesticate the report to fit within our local context, because the report is a global one, and there are things that might work out for us, and there are things that might not work out for us as Africans. So we will just pick what fits within what we are doing. Then the issue of data is also a big problem, and we will see how we're going to ensure this comes out. And I would really want to put a lot of emphasis about data, because when we talk about treatment, harm reduction, there is a lot of information online. But when it comes to prevention, there is nearly less information, despite the fact that there are good interventions that are being done in the line of prevention that are never documented. And if you look at the UNODC report, they echo a lot about how prevention saves lives, how prevention is able to protect the young people. But this is never documented, and it's never brought into the public. So what can we do to ensure that that is also captured fully, especially from the marginalized community like Africa, where we come from? The other point is that I also agree fully that we need to put people to be at the center of which is fully captured. But as much as we are putting the people to be at the center of the report, we also need to figure out, where are the children? The children need to be also at the center. As much as we talk about their parents, the people are their parents, their brothers, their sisters. But where do we put these young people who need this prevention information out there? It is important that we also put that into perspective. As much as we are putting that into perspective, where do we put the commitment by state parties? Because we also need state parties to come on board. We cannot be just coming up with the reports. I remember in 2016, before the UNGAS, we came up with good stuff. But again, implementation was a big problem. So how can we lobby member states to ensure that they implement this report? And I think one of the biggest tools that we need to use as civil society is how can we use prevention interventions to share to them? Because, for example, if you look at Africa, most of the member states usually complain, we don't have enough money. So if you give them an alternate, which is prevention, what can they do with it so that they invest their energies to ensure that prevention work is fully implemented? Then there is also another gap that I strongly feel as civil society we need to work on is the bit of capacity building. And if you look at capacity building again, I will put a lot of emphasis on prevention, because if you look at treatment, there is a lot of training that are being done because we have rehabilitation centers around, treatment facilities around, but where do we put in the prevention? Yes, it's cost effective, it's cheap, it's easier to use, but it lacks no space within the capacity building space. So it's an area that we need to put a lot of emphasis and see how we are going to work. The other point that I would really also want to bring out very strongly is the issue of cannabis legalization. As a prevention influencer, I don't agree with prevention with cannabis legalization, and that is my personal opinion. Because of the children that I work with, you cannot be talking about prevention and at the same time you apply double standard, telling them that this is good. So we need to be very categorical when we develop the global reports. We need to be very, very clear, because I'm trying to imagine if my daughter, who is 16 years old, come across that report and she will start asking that, how about this? How about this? So, we just have to look at how do we put this into the regional, the continental regional bodies to ensure that we have what works. Maybe finally is I've seen a lot of work that have been done on harm reduction, and we say it saves lives, but I strongly believe as much as it saves life, prevention saves more life than harm reduction. So if we can work as a team to ensure that we bring out the voices of the grassroots people who are doing good work in the prevention line, it will be easier to complement the work that is being done by the harm reduction. But if we invest a lot of energy and resources on harm reduction, it will be very, very difficult for us to bridge the gap between prevention and harm reduction. Yeah, I think I have been able to capture most of the key points that I wanted to put across for now, but I don't think if there is anything else that I have missed. I think I've been able to mention it. Then maybe finally is we need, as much as we are talking about the collaboration between civil society and state parties, we also need a lot of engagement. I think one of the areas that we lack as African civil society organizations is that capacity building to enable us lobby the bodies like African Union, the UNODC, the WHO, so that we are able to put this, we cannot be bumping a lot of information to UNODC, yet there are other alternate bodies. How can we bring INCB, INCB board on board to sit down and get this argument? I strongly believe it's a collective responsibility, and we don't need to leave anyone behind. If we work together, civil society, governments, and these international bodies, we will be able to do a lot. So that is it from my end. Thank you very much for the opportunity.
Thank you very much, George, for your intervention and contribution to this webinar. We are running out of time, so Ghana, please, we have to proceed with Marie Nogier from the European Civil Society Forum on Drugs. We only have 1 or 2 minutes left, and if still somebody wants to ask some questions, we will be out of our time limitation. So please, Sarah, could you play Marie's video? So this is the last intervention.
Hi, everyone, and thank you for inviting me to be part of this webinar. My name is Marie Nugier. I'm the Head of Research and Communications at the International Drug Policy Consortium, but I'm here speaking today on behalf of the EU Civil Society Forum on Drugs, the CSFD, within which I chair a working group focusing on international drug policy. So last year, in preparation for the Global Civil Society report, the CSFD partnered with the Vienna and New York NGO committees on drugs to conduct a comprehensive consultation on the 12 challenges that are included in the Ministerial Declaration on Drugs in Europe. So we held 3 online consultations and then 1 all-day consultation in Ljubljana. The consultation went well beyond the CSFD membership. It included dozens of organizations from across Europe. And there is a broad diversity of approaches towards drugs and drug laws. Some of these NGOs emphasize drug policy reform, others prevention, harm reduction, treatment, drug user rights, and much more. Bringing this diversity to policymakers is a major strength for us as civil society, but it was also really interesting that there was a clear unity on one aspect of our consultations, that public health is not compatible with punishment. Arresting, incarcerating, policing people is just not the way forward. You cannot deliver support to the point of a knife. So today, I'd like to highlight 3 key points from these consultations. First of all, we have to meet people where they're at. This means that we cannot impose interventions on people, no matter whether we work in the field of prevention, harm reduction, treatment, care, or recovery. We all agreed that these interventions have to be tailored to the needs of people who experience problems with their drug use. They should be human rights based, and they need to be voluntary. Coercion, forced treatment, forced drug testing can be punishment. It can be stigmatizing, and it's simply not effective. Secondly, punishment inevitably targets disproportionately the people who are most marginalized. People who live in poverty, people who are discriminated against on the basis of their race, of their ethnicity, of their gender, their age, or their migration status, and especially people who are facing multiple and intersecting layers of vulnerability. Thirdly, support for people who use drugs must include the whole spectrum of evidence-based health interventions, including prevention, harm reduction, treatment, care, and recovery for all populations. But support should not go just towards medicalized understandings of a drug service and systems of care. It should go beyond that. In many cases, people need housing, they need secure food, a secure income, support to address gender-based violence, and we also need to better understand the intersection between mental health and drug policy. Lastly, I wanted to note that in line with these findings, the Civil Society Forum on Drugs has recently released a policy paper on gender-sensitive drug policies and programs. And more recently, we also adopted, through a decision by a large majority of our members, a position paper in favor of the decriminalization of drug use and possession for personal use as a key measure to protect the health and the rights of people who use drugs. So I'll leave it here. Many thanks for your attention, and I wish you a very fruitful webinar.
Great. Thanks for sharing that, Sarah, and thanks to Marie for sending in a video intervention. I see that we're over time. We did start a bit late, so I think we've kept you for an hour and a half, but grateful to those who have been able to hang around till this very end. Mate, I think we've run out of time for additional comments and questions, so why don't I pass it back to you to close us out, and thanks from me to everybody as well.
Thank you, Nestle. Yeah, I also feel sorry that we are not able to to have more discussion and questions and answers. But those who want to discuss with us, you can join us tomorrow as well. So you will have another opportunity to discuss different aspects of our global report. And I would like to thank all speakers and all contributors to this webinar. Those also who asked questions and made comments. And thank you all participants who came today to this webinar. And thanks to our board members of Vienna and New York NGO Committee on Drugs, and also members of our committees. And thank you also, Sarah, for our technical support, because we wouldn't be able to to facilitate this without very good technical support by Sarah. So that's my final thought for today. And it was a good webinar, good dissemination of our global report. And see you, I hope some of you also tomorrow at 11 a.m. Central European Summer Time. So I don't know what is the time in your countries, but in 11 a.m. Vienna time, we will meet again tomorrow, and hopefully we will open some other discussions related to report. Thank you very much and goodbye.